Hi, I'm Dr. Hans Brockhoff. I'm the Chief of Head and Neck and Microvascular Surgery here at El Paso Children's Hospital. All right, so I would like to share with you a very unique story, a story of a Roth. He's a 15-year-old boy who came to me with some complaints of swelling and fullness in his left jaw. He had a very rare tumor or malformation of the arteries and the veins in that area, and we call that an arteriovenous malformation. Essentially, it's the normal vasculature or the normal blood vessels, but they start growing and they're overexuberant and they grow out of control and they take over other structures. And so that this was something that needed to be removed because people can actually experience life-threatening bleeding or problems from this type of malformation. So here's a model of a Roth. What you're seeing here is a lower jawbone. We call this the mandible. And you can see his teeth are represented here. And this area that's all colored in is actually the area where the arteriovenous malformation occupied and took over his jaw. There's some marks on here in the area of the jawbone that needs to be removed. So this was his surgical plan based off of his CT scan. This is the area that we're gonna remove. Okay, so here we have the next model. This represents the area that we're gonna reconstruct. This is called a cutting guide. This is provided to me in the operating room based off the CT scan, and I've decided ahead of time that I'm going to remove this segment of his jaw. And the way to rebuild it is to use part of his leg bone. This is called the fibula, and this is connected from one part of the mandible to the other. So this is very unique. You can see that this comes on and off, and this is called a patient-specific cutting guide. And we use this to guide us intraoperatively to make sure that we cut out exactly the part of the bone, not too much or not too little. And this really helps us inside the operating room. This part here is gonna be his leg bone that's gonna rebuild his jaw. And one of the really unique things about this is we can put implants into this leg and we can mount teeth on there. So not only does he get a new jawbone, but he also gets teeth in the area so that later he can go and start chewing and enjoying his life in a way that he had experienced before. And so one of the things that's really special, and I'm very excited to be a part of, is that we really have a really unique team here at El Paso Children's Hospital. To be able to have people of different skill sets and different specialties to come and bring these complex cases that in the past, historically, could not be done here in the area. So it's just really special and really unique, and I'm very excited to see what happens and what comes in the future years.